Welcome to Biztechasia Health and Wellness Show. Today we speak to Melvin Vu, Regional CEO of Good Doctor Technology. Good Doctor Technology is a joint venture health tech company between Ping An Healthcare and Technology, as well as Grab and SoftBank. Now established in 2018 with a regional headquarters in Singapore, the company's mission is to provide one doctor for one family across Southeast Asia. Now, to tell us more with this tagline in mind, welcome to the show, Melvin.
Hey, Brian, thank you. Thank you very much for having me.
Now, Melvin, for a start, tell us a little bit about Good Doctor Technology, what it does and how it started.
Yeah, Good Doctor Technology is a very unique company, right? As you correctly mentioned, we are a joint venture company between three big giants. One is Ping An Good Doctor in China. They are one of the largest telemedicine provider over there. Grab, of course, Grab needs no introduction. They are quite ubiquitous in Southeast Asia. And SoftBank Vision Fund. I think when these three corporates came together, they saw a gap in healthcare in Southeast Asia. Whether or not about accessibility, about affordability, and about reach, right? On how people can access the health care within their countries. So they came together in 2018 and then they set up this company. But I think what is important is although we are a joint venture of corporates, we run and we function like a startup. So I always think of our organization as a startup, a telehealth startup that is building an virtual health ecosystem to really help users or people in Southeast Asia. So, Brian, although the companies, formed us in 2018, but we really got started in 2019, where we launched in Indonesia. We launched in Indonesia as part of a vertical in the Grab ecosystem, and we are known as Grab Health. And so with Grab Health in the Grab ecosystem, our primary objective was at that time to reach as many users at the start goal, right? So it is also very counterintuitive, right? Because, we managed to get our services up and running in Indonesia within 6 months. And I think, in normal startups, you probably would not have that resource or that luxury to do so. And that's because we are able to leverage on a lot of different strengths of our shareholders, right? Technology from Ping An side, the distribution channels, the ecosystem from Grab, and of course the connections from SoftBank. Right? Although we started operations in Indonesia in 2019, as you rightfully mentioned, we have a HQ in Singapore, where our product folks are here, our tech folks are here. So it's mainly about developing new technology, thinking through new strategies, new business models, as well as new products. Brian, telemedicine is something bordering controversy, because when we enter into Indonesia, people were not very familiar with telemedicine, although they already have the incumbent there for about 5 years, but regulations and the mentality of telemedicine isn't really developed at that time, right? So one of our goal was to try to, as much as possible, educate the public and also try to work together with the governments and keep educating the governments on what telemedicine is, on how telemedicine can help the whole health ecosystem.
Especially in a distributed environment like Indonesia. Not so much as Singapore, but very much so in Indonesia, where healthcare access, particularly in remote areas, to specialist care in particular, is very, very limited or non-existent.
Yes, and when we first started and when I was there visiting, whether the hospitals, whether or not the clinics in the rural areas, which is what they call Pukimas, right, which is the central clinic, people have to travel from the rural areas for about 2 hours. Imagine the Jakarta traffic, 2 hours into the clinic, queue for another hour and a half because the clinic is always overcrowded. And then when they actually see the doctor, it's like for probably 3 to 5 minutes because it's usually for a normal cough, normal flu, right? And then they spend another 2 hours getting back to their rural areas. So in total, they probably spend more than 3/4 of the day just to get a simple treatment. So for us, we think that, hey, there must be a better way of doing this, right? So that's where the platform literally helps, right? It's what we also like to call it's like doctor in a pocket, right? You whip up your mobile phone, you fire our app, and then within 30 seconds, you get to consult with our doctors via chat, right? Because we find that chat is one of the most efficient way of talking to our doctors, and a lot of Southeast Asians are very enamored to their mobile and chatting with their friends. So it's something very habitual for them.
Yeah.
So when you have something very habitual, and then when it comes to healthcare, it's easier for us. It's easier for them to also understand how to use, right? But I think as I was saying that what literally helped us scale and grow, for better or for worse, it was really the pandemic. And people always ask me, how did COVID treat you? And I say, actually, COVID is very nice to us. It's not the correct thing to say, but COVID is very nice for telemedicine providers and players.
So, and that's across the board, isn't it? In terms of the whole med tech industry exploded during the pandemic because on the consumer side, obviously, they couldn't reach patients. On the business side, they couldn't reach healthcare facilities, and it was harder. You had lockdowns. On the business side, corporations and CEOs suddenly realized that healthcare became front and center because they had a distributed workforce. They had mental health issues that were cropping up. There were physical health issues. They needed to make sure that all of this was addressed. And so companies like you came in and just grew.
Yeah. I think it is really a process and a progress thing, right? I mean, when COVID first struck, people don't know what to do. People don't know how long it will last. People don't know how fast it will spread. So I think the first stakeholder to really embrace telemedicine was the governments. Because imagine if people from the Euro areas like Indonesia or Thailand, where we operate as well, all rush to hospitals or clinics just for simple ailments during this COVID pandemic. The spread of COVID will be exponential. So the governments know that they needed a solution to stop people from going with simple ailments, from going into and overcrowding the health infrastructure, which at that point in time couldn't cope with the excessive number of patients, whether is it COVID or whether is it normal diseases. And then after that, after a year or so, then that's where corporates come in and say, oh, shucks, now people cannot go to work. People are, as you mentioned, distributed. But then how do we engage them? They are suffering from burnout. They are suffering from, really like the boundaries are blurred between work, home, play and stuff like that. So how do we keep the workforce going? And so that is where I think is the next phase of growth for telemedicine, Brian. Because in the normal phase, we are focused very much on sick care. Because when you are sick, you power up a doctor in the pocket, and then you consult the doctor. But increasingly, as where the corporates, CEOs, and HR practitioners realize that they also need a solution to prop up the wellness and the health of the employees. So that's where lifestyle and wellness comes in telemedicine.
That's why, and you're spot on, because that's a global trend as well. That shift away from an illness paradigm to a wellness paradigm. So prevention rather than cure.
Yes. And I think that is where our next phase of growth is as well, right? I think we spent 2.5 years in Indonesia and another year in Thailand. We launched it a year ago during COVID as well. We focus very much on sick care with our technology and with our parents, Ping An's experience. But now increasingly we are slowly developing more services to really look at preventive, not a preventive, but also lifestyle kind of wellness, right? Your fitness, your diet, and also also increasingly, what we are also looking at is also chronic diseases. So it's really these three pillars that I think will underpin a whole kind of a virtual healthcare going forward.
Okay, but Melvin, let's break down then. These are the things that you're doing, but how are you doing them? What is the technology stack and services underlying all of this?
Yes. So I think really is twofold, right? I think one is our platform that we have really inherited and of course customized for different countries from China, and actually, they have done it for 7 years. So it is a fantastic platform that
and mature, obviously, because they've done it for 7 years. They've all you needed to do was literally just localize according to the needs of the market.
Yes. So the technology is very important. And what is interesting for us is that we've emphasized a lot of flexibility of integration. Because to us, telemedicine is just a component of a wider health ecosystem. And we don't want to exist in isolation. For us, very importantly, we want to build an ecosystem with different like-minded partners like hospitals, clinics, whether your gyms and things like that, right? So in order to do that, your platform must be as flexible as possible to integrate with other people's technology and platform as well. So that's one of our strengths. The other one of our strengths is really about having hired doctors in our company. A lot of, if you look at it, a lot of traditional telemedicine providers outsource their consultations to external doctors.
One of the things is the argument around it is it's an asset-light model.
Yes.
And it's a distributed model so that the existing doctors can benefit from additional revenue.
Yes. But for us, we look at it from a different lens, right? We hired a core group of doctors within our payroll or within our organization. And what they do is they standardize consultations, they standardize quality of consultations, they standardize, and they all come together to talk about new ways of treating certain ailments. But you must remember, this is about treating patients or talking to patients online. It's not offline,
Yes.
It's online. There's various different ways of doing it. There's numerous different mannerisms. There's different ways of communicating with the patients. So having a core internal doctors really gives us the advantage because we can control the quality, we can control the type and how they do their consultations.
I have to interrupt you there because that is a very, very important issue. Because a lot of times, so while the business reasons for being asset light and distributing the doctors are very compelling, for the patients themselves, that's a less compelling value proposition because each time I log in, if I'm talking to another doctor, well, he can pull up some of my data or so forth, but the reality is the consultation is not as rich compared to somebody that I've been dealing with regularly. So the whole thing about one doctor for a family resonates with someone like me.
Yes, and I think this, Brian, I think this is increasingly this is what we are trying to do, where the technology is mature enough to be able to assign the same doctor always to a patient, even in a virtual setting. Unfortunately, that is something that we are still working on. What I mean is that, we have in-house doctors, but a patient can request for the same doctor all the time. But what we see is they don't. They come in, they are more than happy to talk to any of our doctors in-house as well. But yes, traditionally it makes business sense to be asset light, but I think we always think ourselves more than just a technology company. We also think ourselves as a healthcare company. So I think it's that mentality, Brian. A technology company, you focus on a lot of the different metrics and things like that, right? But I think we need to bring in the softer side of healthcare, where we put patients front and center as well. And if somebody come in, sometimes they are sick, they need help. So yeah. How do you manage that without the matrices at the back of your minds? I think that is very important.
So Melvin, so this is the reason then why you've also then adopted an online to offline model as well. And you set up a physical Good Doctor clinic in Thailand. Tell us about that and what really is the strategy around that?
Yeah, for us, traditionally, as you mentioned, right, any tech companies, we don't like asset. We want to be as asset light as possible. But I think in telemedicine, where we are trying to build an ecosystem, it helps to be in that frame of online and offline, because Brian, whether in China, whether it's in Indonesia, or whether in Thailand, telemedicine can only diagnose and treat 36% of patients coming onto the platform. Only 36%. The rest, we have to refer them to our ecosystem partners, right? Whether it's hospitals, labs, and clinics. Now, in Thailand, we built a clinic, really for only one purpose, bro. It's really because out of regulation. But building that clinic also helps us build a brand. Because now with that clinic, our clinic is located in central Bangkok, in one of the more populous office CBD area. So we are there, and our core strategy and business model is B2B. Go out to corporates, reach out to corporates and insurances, and to help to encourage them to utilize telemedicine as part of their program. So with our clinic there, it gives corporates not only the branding, but it also gives them an opportunity to come down to our clinic, chat with our doctors, consult with our doctors, because we still do offline consultations at the clinic. It doesn't mean that we don't. Doctors are there, they consult, and our doctors will also start telling them about telemedicine, right? What is telemedicine? How can they help the company and things like that? So having a physical clinic allows us to do that, right? So, but with the clinic, we make best use of what we have. We make best use of the asset. And this is where, the clinic now, you can go in, you can do certain medical checkups, you can do certain tests. So it is a full-fledged clinic that we have. And it helps us further the cause of telemedicine and virtual healthcare.
So one of the key challenges, if you look at it, is the fact that adoption was accelerated during COVID.
Yes.
But then now people have access now to their doctors physically again. Have you seen a drop-off in utilization? And just give us a sense of some sort of numbers that you've had in terms of growth and consultations.
Yeah, so I think during COVID, we had about probably 10x of consultations coming into our platform, right? Whether is it Grab Health, or where is it we have another standalone app in Indonesia. So it's about 10x. But what we see, yes, numbers have come down, but it came down to pre-COVID levels, right? And the baseline is actually increasing. So what this tells us, that those people who come during COVID, some don't come back anymore, but the baseline of patients who are utilizing telemedicine have increased. So the shoreline has increased, right? Okay. Which is what we want, to get as many people to be used to telemedicine. But of course, Brian, but now the strategy is a little bit different. We are now focused on B2B. So customer, corporates and insurances, and even working with the governments now are more important for us. The B2C market is something that we let it grow organically.
Because you have basically expanded and put a primary focus on the B2B market, give us a sense of what your overall ecosystem looks like in terms of partnerships and alliances.
Yeah. So when we focus on that, right, I think a few components within the ecosystem is very important to us, and it all boils down to the fact that telemedicine, virtual healthcare, and telemedicine is not and all, right? You still need to have partners. So in Indonesia, we build very strong relationships with hospitals, with insurance partners, with third-party administrators. We were chatting offline just now. We were talking about payment claims, and it's still going on, in Indonesia. But now the third-party administrators are quite large. They help companies, manage their claims. They help insurances manage all their claim loss and things like that. So we work with them. We work with labs as well. But more importantly, because on our platform, a user can also come into our health mall to purchase medication, and things like that. So working with pharmacy partners, merchant partners. So we are a marketplace, right, of pharmacy partners and, merchants and things like that. So building that relationship with them and integrating into our ecosystem is very important. So for example, in Bangkok, right, we started, you know, in only 12 months ago, but within the whole Bangkok and within Thailand itself, we have one of the largest, in fact, we have the largest pharmacy network in Thailand of about 890 outlets. When our doctors prescribe medicine, right, the system will pinpoint the nearest pharmacy to the patients where they are located, and then we will send a rider, usually, you know, a Grab Express rider, to collect the medicine and deliver it to the patients all within an hour.
Okay, but that, Melvin, is in a prescription market. So there are some markets where the doctor is allowed to prescribe medication. How do you cater for that?
Oh yes, so I think it's still the same principle, right? You know, our doctors in Indonesia, we do prescriptions as well via the chat. So we because of the pandemic, we were able to prescribe what we call red dot drugs or restricted drugs, like your antibiotics and things like that. So the doctors do prescribe, but the onus is up to the patients of whether or not they want to purchase it from our partners on the ecosystem, or they can take that same prescription and then go fulfill it themselves, whether in the nearby pharmacy and things like that. So the principle is the same, right? Our doctors do prescribe.
Now, looking ahead now, Melvin, where do you see some of the growth opportunities for you in the region, and especially highlight for us perhaps some key trends in this whole telehealth and medtech space?
Yes, and you know, as I mentioned just now, I believe that the growth in medtech space will no longer be just focused on sick care. It will be based on really a couple of pillars, right? One is wellness, and wellness is really about preventive, how you prevent somebody from being sick, right? And we work with, you know, corporates and insurances on that as well. The other one that I'm actually quite passionate about is chronic diseases. I think, you know, for example, in Singapore, right? I mean, you know, the government is placing a lot of emphasis on diabetes. It's the #1 silent killer in Singapore. So I think in telemedicine, because of our ecosystem and because of, you know, if a patient comes through our system and we are able to have various data from the patient together with the platform that we are in our health services as a solution strategy, we are able to advise the patient on a lot of things, right? Whether is it treating his chronic diseases or whether is it preventing his chronic diseases from happening. And I think also, you know, going forward, for any health tech platform, there has to be integration with certain hardware. It's already happening now, you know, whether it's your Apple Watches, your Samsung, or your Android devices. But I think there will be closer integration with health tech platforms, physical devices, whether or not it is for, you know, the elderly at home, right, where there's smart devices that detects fall or detects or remind them of taking medicine and things like that. So I think putting together the whole ecosystem in the platform is going to be real exciting.
Melvin, one of the key things then, and you alluded to that without highlighting it a little bit further, the holy grail for healthcare has always been the ease of sharing of your electronic medical record.
You know, yes, you know, I totally agree with you. I think this is the holy grail. This requires a lot of work. But how you know, this is something that we can't solve alone. It has to be various conversations with, you know, the governments, you know, other hospitals, other healthcare providers. You know, in Singapore, we started it, I know, you know, the HIS, the health information system. But if you see, it is only with the public sector. The private sector is not plugged in yet. But what is interesting to me, Brian, is, you know, just to simulate some thinking, is that Web3 and blockchain represents a very interesting avenue for storage of medical data that will belong to the patient. Now, if you think about it, you know, this is for me coming from personal experience, with family members and stuff. When you see a specialist or you see a GP, you don't get to own your data.
Correct.
They own your data.
They own your data, and in some countries, they don't have to pass it to you.
Yes, they don't have to, right? But even in Singapore, people don't pass. Your GPs don't pass the data to you. I don't know what they write in their computer system when I consult them, right? So I think you are right. The electronic medical data passing through various facilities, infrastructure, platforms. But the most important thing is, how do we think about having the data ownership back to the patient, where then at any point in time I want to share, or I don't feel like sharing, or I want to understand more about what the doctor tells me about it, I have easy access to the data.
Melvin, it's been a fascinating conversation. Before we leave, any final thoughts you'd like to leave the audience with?
I just hope your audience will be very open to virtual healthcare and telemedicine. I think it's something that is not a pandemic novelty. I think it's going to be here to stay. I think it is something that you will see more growth in, and it will sort of permeate more into our daily lives on how we use virtual healthcare together with all your connected devices.
Now, Melvin, thank you very much for coming on the show.
Thank you, Brian. Thank you for having me.
Now, I'm Brian Fernandez, and we've been speaking to Melvin Vu, Regional CEO of Good Doctor Technology, on Biztech's Health and Wellness Show. This video and podcast will be on our website, www.biztech.asia, as well as our social media platforms. It will also be on our syndication partners' TV stations, radio stations, and websites. Thanks a lot for tuning in.